don't know me, I'm Martin Shapiro, and I'm just introducing the speakers. And today we're very happy to have two speakers from Ithaca, um, Mildred Warner and Xue Zhang. Mildred is professor in city and regional planning at Cornell University, and her research focuses on economic development, social services, and environmental policies of local governments. She's an international expert on new models of service delivery and finance, especially in the context of privatization and decentralization. She also leads the Planning Across Generation project, which links planning and public health. Xue Zhang is a postdoctoral associate in the department, and that's the Department of City and Regional Planning, and also the Department of Global Development at Cornell. And she's interested in regional development, equity, community development policy, and public health. And her research focuses on local government actions in building age-friendly communities. And her research links community health with planning, built environment, and services to explore community development services. They're going to be talking today about the politicization of public health in the COVID-19 response. And they circulated some very interesting papers relating to the shutting off of the water supply for people who are unable to pay their bills, and how that varies across the country. The general issue of public ownership of utilities as it relates to water policies, and and issues related to stay-at-home orders and how they vary across the states. So this should be really interesting. Hopefully, we know it's going to be somewhat depressing, but insofar as it gives us new insights, hopefully it'll also be uplifting. Go ahead.
Thank you very much, Martin. So I was on sabbatic this spring, and of course all my travel got canceled. And so Xue and I were busy doing some analyses looking at the impact of what differentiates state responses to COVID-19. And we're really happy to be able to present to the Health Equity Group today and get some insights from you, questions, feedback about these studies. And as Dr. Shapiro said, the first set of papers we're going to talk about is on water shutoff moratoria, protecting people from having their water shut off in the COVID-19 pandemic. And then the second set of papers looks at stay-at-home orders and reopen orders across the 50 states and the role that social safety nets seem to play in states' policy choices. So y'all are very well aware of the social determinants of public health. Xue and I are regional scientists and planners, and so we tend to focus mostly on the neighborhood and built environment, the social and community context, and the economic context when we make a link between our work and public health. So today our focus is on access to water, access to social safety net policies, and the state policy responses with respect to water shutoff protections and stay home and reopen orders. So of course we all know that access to water is threatened by shutoffs. It's a threat to human health. You can't wash your hands, you can't drink, you can't cook, you can't clean, you can't flush your toilet, shower. It forces people to have to leave their homes. Sometimes it leads to foreclosure, as unpaid water bills can cause you to have liens on your home. And so the Food and Water Watch advocacy organization has been tracking this issue, and they noticed that beginning in March, a number of states and cities started putting in moratoria on water shutoff to low-income households. And so they began to track that, and we're using that database here. So you all may not be aware, but the US, we always have US exceptionalism, right? So the US does not ascribe to the UN right to water. So we don't guarantee universal access to our residents. And we don't have minimum daily allotments. If someone can't pay their bill in other countries, most developing countries, most and all of Europe, there's a minimum daily allotment you get, even if you're not paying your bill. That's not true here. We have a growing water affordability crisis. The EPA recommends that households should only spend no more than 2% of their income on their water bills, but many low-income households in the US spend up to 10%. Now, some cities and states have instituted subsidy programs, Michigan, New York, Philadelphia, for example, but other states prohibit consumer assistance plans, subsidies by their utilities. And there's a really interesting report out from the UNC Environmental Center on that topic. And most states and cities do not protect low-income residents from water shutoff. That's the status quo. And one of the reasons for this is that water systems are under a whole lot of pressure to reinvest. You know, older cities built their systems around 120 years ago. More recent cities would have built their systems 30 to 50 years ago. All of these systems are ready for replacement. You may remember a few years ago when Mayor Minor from Syracuse told the governor that rather than the Buffalo billion that he sent for economic development out to Buffalo, she'd like a Syracuse billion to replace their aging water pipes, which are still made of wood. So we need a fair amount of money, and the amount of federal money and state money to invest in water system renewal has plummeted. So then we get to the COVID-19 pandemic, and we see a lot of structural inequities. We're going to talk about 4 social safety net policies that we are going to look at in the second set of papers. And these are on paid sick leave, health insurance, minimum wage, and TANF welfare benefits. As you probably know, there is no national policy in the US on paid sick leave. Only 12 states require employers to provide paid sick leave, and many of these provisions are only for employers with more than 50 people, 50 employees. A Better Balance is the organization that tracks this data. Then we look at health insurance access, and we code this for the 36 states that expanded Medicaid under the Affordable Care Act. Kaiser Family Foundation tracks this. The federal minimum wage of $7.25 an hour has not been raised since the 1970s. It now has 1/3 of its original purchasing power. So 29 states have raised their minimum wage above the federal minimum. And in fact, even in 2018, conservative states like Arkansas, Arizona, and Missouri voted to raise their minimum wages. And then the Urban Institute tracks TANF benefits, and here we're using the benefits for a family of 3. And as you know, welfare benefits in the US are limited in terms of eligibility and in terms of duration. President Clinton reduced it to a 5-year maximum lifetime benefit, and they're lowest in states with more minority populations. So I think it could become clear to you by now that states and localities play a really critical role. In water, the state can provide subsidies for water systems. The state can regulate water utilities, and 45 states regulate private utilities, and 6 regulate public utilities. States and localities can protect low-income residents from shutoff, and states can encourage or prevent support for affordability programs. With regard to social safety nets, states determine the level of health and welfare supports. We're in a federal system. States get to choose. They can choose to exceed federal minimums, and many do. And sociologists use something called the Welfare Conventions Framework to think about this. So some countries or states are more communitarian or civic in their orientation, and others are more market, entrepreneurial, financial, behavioral in their justifications for their welfare interventions. And the US is on the market side of things. And we argue this leaves very limited space for thinking about social welfare programs in terms of their public benefits and addressing public health. We tend to, in the US, think about them in terms of individual responsibility. So if a state is going to choose to protect water access, social safety net, public health, it's going to require capacity and political will. So back in 2015, I ran a national survey of all cities and counties in the US on their environmental sustainability actions. And one of the questions that we asked on that survey was, do you protect low-income households from water service shutoff? And only 8% of the sample did. We ran regression models to see which municipalities were more likely to protect from shutoff, and we found that those that owned their own water utility, it's municipally owned, those that had an articulated equity goal in their community sustainability plan, so they actually say they care about equity, those that had a Democratic majority on their governing board, and interestingly, not cities, but suburbs and rural areas, after controlling for everything else, were more likely to protect residents from shutoffs. And then at the state level, if the state regulates public utilities, they were more likely to protect from shutoff. And this article, it came out this spring, but we had done the research quite a few years ago. And anyway, PubMed picked it up and utilities policy allowed it to go out because it is relevant now as we think about COVID-19, even though this was prior to COVID-19. This data is from 2015. So COVID-19's changed all this. Since March, 35 states have imposed moratoria on water shutoffs. 483 cities have imposed moratoria on water shutoffs, and 111 of these are in states that did not impose moratoria. So these cities are of particular interest, and we run a state model and then we run a city model on just these 111 in the 15 states that did not have statewide moratoria. And the question we're asking is, what differentiates the states and cities that protect residents from water shutoffs in the COVID-19 pandemic? And what we wonder is, will there be an ongoing effect in leading the US to join other countries in actually protecting residents' basic right to water? Many of these moratoriums have end dates, so it probably won't be the case that we'll change our public values, but it would certainly be nice. So here's a map that Xue made, and you can see the states that imposed their moratoria early in those first few days in March after the pandemic was declared. Then you see those that imposed in the second half of March, then those that were much later imposing in April, and then those that are in white that never put in a statewide moratorium on shutoffs at all. And the white circles are the cities that put in their own moratoria policies. Remember, most utilities are controlled by the local government. So what the city decides to do can be extremely important. And so we're going to do one model on states and one model on those cities in the white states where the state did not do a moratorium. Our conceptual framework is to look at both the state moratorium and the start date of that moratorium and control for, we're looking at the importance of the percent private ownership of water. Most water in the US is publicly owned, but a few have been privatized. We're going to look at whether the State Public Utility Commission regulates private water ownership. We're also looking at political partisanship. And here we differentiate unified Republican control, where both the state legislature and the governor are Republican. We also control for the COVID-19 confirmed case rate as of March and April, and socioeconomic conditions, unemployment, poverty, urban population, minority population, because these are the populations that are more heavily affected. In the city model, we, to get at our political interest, we use the percent that voted for Trump in 2016. This is at the county level. We also use a measure of community health that AARP came up with. This is based on the WHO's 8 domains of livability for aging, and the COVID case rate and socioeconomic conditions. And here we also include income inequality, the Gini, and access to health insurance. Just briefly, since this is a health audience, AARP has developed a set of livability indicators for every zip code in the US. And in the health indicator, it includes 3 healthy behaviors: smoking, obesity, and exercise, access to health care in terms of professional shortage areas, and quality of health care, preventable hospitalization rate, and patient satisfaction. And these are aggregated into a factor score. And with that, I will turn it over to Xue to talk about the models and the results.
Thank you, Mildred. So in this research, we are interested in what factors differentiate states and localities that have implemented water shadow moratoriums from those that have not. To answer this question, we ran two types of models. We ran the first as logistic regression on state moratorium to analyze what factors related to whether a state imposed moratorium. And we also do a logistic regression at city level to analyze what factors are related to if city imposed moratorium for those cities actually within state without a statewide moratorium. We also run another type of model, which is level analysis. Most of you are familiar with this model because it's widely used in medical research. So in this survival analysis, we want to know the date. We want to know what factors related to the date the state respond to pandemic. We analyze the date to the state issue a state imposed moratorium and the date when COVID was defined as pandemic by WHO. And for the state that did not impose moratorium, we code it as 99. We want to know what factors are related to an early start date. Next, please. So in this slide, you could see the model result at state level. And on the left side, it shows the result of logistic regression. On the right side, it shows the result of early start date. We can see those two models show similar result. The Public Utility Commission regulates private utility is positively related to the state moratorium. If a state has a PUC regulated private utility, it's more likely to have a moratorium on water shut-off. Those states are also more likely to have an early start date. And for the result of unified republic control, we found the opposite effect. For states with a unified republic control, those states are less likely to have a moratorium on water shut-off. Also, those states are more likely to have a late start date. We also found the early start date as a response to the COVID. For the states have a higher percent of confirmed cases in April, those states are more likely to have a late start date. Next, please. So in this slide, we see the model result at the city level. On the left part, we analyze what the city capacity related to the city level imposed moratorium. We found that cities has more capacity, which is measured by per capita income, are more likely to impose moratorium on water shut-off. Also, the cities has more need, which is measured by percent minority population, and the Gini index are also more likely to have a city level imposed moratorium. When we add the variables at the county level, we found that cities have a higher voting rate for Trump in 2016, are less likely to impose moratorium on water shut-off. And on the other hand, cities rank higher on community health, are more likely to impose moratorium on water shut-off. Next slide, please. So what we learned from the moratorium research, we found the politicization of public health. For the state-imposed moratorium, we found that it's more likely to happen in states which regulate private utilities, also had a higher COVID-19 case rate. But the moratorium are less likely in states with republic control. And for the city-imposed moratorium, we found that the imposed moratorium are more likely in cities with capacity, which is measured by a higher per capita income, also have more need, which is measured by minority and inequality. Also, the city-imposed moratorium less likely if at the county level has more Trump voters in 2016. This research shows that imposing a moratorium on water shut-off requires both capacity and political will. Next slide, please. So let's turn our interest to the next research. What about the stay-at-home orders and reopening orders. We all know that states play an important role in the absence of federal leadership. In response to the COVID, states take the leader role in the case test and prevention. We also know that there is a wide variation in when the state lockdowns and also when the states are reopened. This triggers our research interest in the trade-off between public health and economic hardship. So we are interested in what social safety net helps states impose stay-at-home orders earlier and reopen late. To measure the social safety net, we use 4 elements, which include if the state has expanded Medicaid access and ACA, if the state has paid sick leave, if the state minimum wage higher than federal. Also, we include the temporary assistance for needy family benefit level in the social safety net measurement. So in this research, we would like to explore if there are differentiation by partisan political control. Next slide. So in this slide, we can see there's 2 maps. On the left side, it shows when the state has a stay-at-home order. And the darker color means the state has an earlier stay-at-home order. And on the right side, it shows when the state reopened up. And for a darker color, it means the state reopened late. So we can see these 2 maps see a relation between the stay-at-home order start and the reopen date. And for example, New York, we all know that it has the early stay-at-home order start because the increased COVID case. And on the right side, we can see it also have a late reopen date. So in this research, we want to see if we could differentiate which factors is related to an early stay-at-home order, also which factors is related to an early reopen date. Next slide, please. So this is our conceptual framework. We would like to analyze 2 types of state actions, stay-at-home order and reopening date. We want to know if the state actions is related to social safety net, which is measured by the 4 elements, and it is measured by a factor score. We also want to know if the state action is related to inequality, political partisanship, which is measured by unified republic control, the same as a watershed of paper. We are also interested in economic dislocation, since the reopening date is mainly a response to the high unemployment rate, especially in April. We're also interested if the state's action is related to public health, which is measured by COVID-19 positive test rate. We also controlled for demographic structure, including urban population, minority, and older adults. Next slide, please. So this slide shows that we use factor analysis on the social safety net. All the 4 elements group it together to form one factor score. We also use the same methodology to create a factor to measure inequality, which include Gini index and poverty rate. Next, please. So we also run survival analysis model to analyze which factors differentiate the date of stay-at-home and reopening orders. For the survival analysis, we want to know the number of days since March 11 when COVID defined as pandemic and the date of stay-at-home order or reopening order. How is the date related to the social safety net, related to inequality, economic dislocation, political partisanship, and demographic structure? What are those factors related to an early start date, and what factors are related to an early reopen date? Next, please. So here we can see our main result. We found that the impact of republic control on the start date or reopen date is opposite, is totally different from the impact of social safety net and inequality on the start date and the reopen date. For a state with a higher level of social safety net, it's more likely to have an early start date, but a late reopen date. And the inequalities shows the same result. A state with a higher level of inequality has an early start date, but late reopened it. But for the state with a republic control, those states are more likely to have an early start date. Those states are more likely to have a late start date on the stay-at-home order and early reopen date. And in the early reopening model, we also found that states with higher percent of urban population are more likely to have a late reopen date, but states with higher percent of minority are more likely to have an early reopen date. Next, please. So this map shows the relation of our two main variables, social safety net and republic control. We can see that for the state has a republic control, no state also have a lower level of social safety net. Next, please. So the above is the model result. And now I'm going to turn the presentation to my colleague, Dr. Werner, to lead us to a discussion and result.
Thank you, Xue. So I want to go back to the welfare conventions framework. And in the varieties of capitalism literature, we understand that the US is a liberal market regime with very limited social welfare supports. And the US social welfare state is primarily focused on workers. In fact, most of our benefits come through employment, not through the state. Your health care, your retirement benefit, access to paid leave, these are employer-based benefits, not government-based benefits. And when there are government-based benefits, they tend to be focused on the deserving poor, primarily older adults through Social Security. But for the undeserving poor, as Michael Katz has described in his book, our social safety net supports are very, very stingy and very limited. And this federalist structure in the US leads to huge differences across states. And as I said before, the benefits are lowest where there are more African Americans in the population and more poverty. And this has caused, Michael Katz titled one of his books, The Price of Citizenship. Where you live has a huge impact on what citizenship rights you can enjoy, especially as regards social safety net protections. And now more recently, there's been strong corporate pressure to reduce citizen expectations of the state. And the Koch brothers American Legislative Exchange Council has been producing model legislation and giving it to state legislators to put into their state legislative agendas to try to change and further reduce access to labor rights, social welfare benefits, public health protections across the states. It's an agenda focused at the state level rather than the federal level, with the idea that they could be more successful there. And indeed, they have been. So we argue that this entrepreneurial market welfare convention that we have in the US makes it much harder for us to move forward right now when we're dealing with a broader communitarian, community-wide public health goal. So the sad result of this set of papers is the clear politicization of public health. These Republican-controlled states, where both the legislature and the governor is controlled by the Republican Party, were less likely to protect from water shutoff. They imposed their shutdown orders later, they reopened sooner, and they have lower social safety net protections. And we argue that social safety nets should be considered as part of a public health response. But these market welfare conventions on which US social welfare is based make these broader public health goals much harder to achieve. But in that is also an insight on how we might move forward, which is by showing the connection between economics and public health, that these two things go hand in hand, as many have argued, maybe most well known as Paul Romer. So will the pandemic lead the US to a more socially just policy response? We could hope. We'd also be appreciative of your ideas on framing some of this work for public health journals. We tend to publish in planning and public policy journals and think our work is relevant to public health, but we would appreciate your insights on ways to make it more compelling to public health journals. And then I just mentioned here again the papers that we presented here, and we sent early drafts to all of you. But we look forward to your comments. And with that, I'll open it up for discussion. Thank you.
So in terms of fielding questions, I guess I'm not sure how to handle that. Perhaps anyone who has a question can just speak up. I don't think anyone is.
Is everyone muted, or can they have
Everyone
to ask to
is muted
unmute?
at
Can
this
we
time.
unmute them?
We can unmute ourselves.
Thank
Yes.
you.
So while we're figuring out how to ask questions, let me just ask a question or make a comment. First of all, amazing work. Obviously, this was done very, very rapidly. You know, I wonder if, so I think the American Journal of Public Health would probably be very interested in this as is. I don't think you really need to change an awful lot. But it strikes me that, you know, if you just go to the New York Times, you can get sort of case counts and deaths, which would add more punch to this set of studies, because not only do you have early reopening, late reopening, water shut off, water not shut off, I think there's you know, adding what the ultimate consequence of these decisions is, which is more cases and more deaths, could potentially heighten the relevance and the visibility and potentially the type of journal that you can get into. So, you know, I think with those kinds of endpoints, you would be shooting for the top public health journal. And I might just say, if you add mortality and case numbers, you might even get into something like the Journal of the American Medical Association, because they tend to take things that are splashy news headlines. Sometimes it's a bit of a long shot, but they're very quick with their decisions. So if you don't make it, it's like a week delay, essentially. And I think this is highly relevant and current work that the medical community, as well as the public health community, I think would find very, very interesting.
So thank you very much, Monica. I just want to point out that in this model, we were predicting the stay-at-home order, and we were using the positive cases over test rate to predict that. And what you're suggesting is, now that we've got more time and we've seen the terrible surges that we're seeing, particularly across the southern states, at the point we could make the positive case rate the dependent variable and linking it to, for example, when they reopened.
Yeah.
So flipping it so that the variable is actually a public health variable on the dependent side, not a policy variable.
I think the mortality rate doesn't work well because it's so heavily weighted in the Northeast right now. But I think if there's some way of modeling the incidence, incident cases over time, and how that relates to this pattern of early or late opening and closing, I think that would get at what the point that Monica was making.
Yeah, thank you. We started, Xue started pulling, we were using the New York Times data, and we started pulling these and running them early. But again, you know, because New York State so dominated the data early on, that then we moved up from the county level to the state level to start running models, and then the data starts settling into more of a pattern that you can start capturing something in May. But now that we're in July, your idea of making the COVID measures the dependent variable and running it the other way around could work, could give us some very interesting and also distressing results. But thank you for that insight.
Hi, this is Shashi Kapadia from Medicine. Thanks so much for that talk. I just wanted to add to Monica's point, if there's a challenge in terms of the case counts or mortality because of lag time, you might also be interested in looking at some of the process measures like testing capacity and things like that. That's also, I think, similarly splashy in terms of what people are talking about right now. Might also be available from public data.
Okay, thank you. Other questions, comments for us? The other thing we may start tracking is these water COVID-19 moratoria. Many of them will end. just like the eviction protections that Cuomo has in place. You know, they're in many states they're there and they're going to end. So we might be able to track that too, though it's not likely to show up in case rate data, I don't think. It's more a logical notion that you need to have water in order to wash your hands, go figure, right? But that it would actually show up in your case rate, I don't think it will.
You know, there may be, sorry.
Oh, sorry. I was just going to ask, is there a source or is there a way to track actual water shutoff in addition to the policy? Meaning, can you get down to that impact? I imagine that would be hard.
The problem is that there are literally thousands of water systems across the U.S. and they aren't combined in a, there's the American Water Works Association has some data, but it's very, very hard to get that kind of data. And so that's why when I did the national survey, we had just asked, does your city or county have a water shutoff protection? And actually some of the utility people critiqued us and said, that's not actually getting at all of the ones that might have it, because the utility might be a separate corporatized entity and it might have a protection that the city or the county doesn't know about. So getting access to this kind of, I don't think anyone's collecting it. That's the problem. So getting to the household level, there have been some very interesting reports that have looked at the issue of shutoff and access to water by race. It's really quite alarming and awful. NAACP has one out. A group working with Oxfam has one out. But those tend to be, you know, like they'll focus on a few states or a few cities.
Right, that makes sense.
In addition to the issue of the timing of the closure and the opening, there are some obviously related issues like mask requirements and halting or reversing of a reopening that might also look to be related to some of the other issues that you've been exploring. I don't know if there's enough data yet on that. I mean, it's obviously a very, I guess I shouldn't say in this case, fluid problem, but that might be worth taking a peek at as well.
And we did try, and Xue, you might want to speak to this, we tried the level of reopening.
Mm-hmm.
Yes, we use the data from New York Times, and they have the level of reopening. They measured 6 sectors, and if they reopened. They also have detailed information about the subsectors inside the large sectors and when it reopening.
But when we looked at it, and then you have the issue of regional reopening, like up here in upstate, we've reopened a whole lot more than you guys down in New York City. And so it becomes, that would not do so well for a state analysis. We need to move more to a county level analysis, which we had started with earlier and is what we really wanted to be able to do because we do a lot of our analysis at the county level on a lot of other factors. But the state choices seem to be the big ones going on here. There's also a group that's looking at preemption. States through these Koch brother Alex sponsored preemptions on public health protections are actually, and you've read about some of this in the press, where the state prevents the city from shutting down, forces it to reopen, prevents the mayor from putting in a mask requirement. So these preemptions of local authority by these more conservative states. And of course, then we have preemption of local authority by a more progressive state like Cuomo preempting what a city may want to do. So preemption can work in both directions, but it's the state taking power away from the local. And you're more concerned about that when the local is protecting public health and the state isn't. If the state's going to do it, that can often be better. But these are the kinds of things you have to think about in a multi-level analysis. You've got all these cities and counties that are having a lot of variety in what they do, and then you have a state policy rule that can affect their choices.
Is there much state variability in eviction policies?
You know, we don't study housing. We don't have the background domain knowledge on that in general. Yes, there's going to be variation in state policy on everything. You name it, it'll be there. but you then have to, when people, I study local government and people ask me, you know, well, how do local governments work in the US? And I said, well, they work differently in all 50 states. The rules around finance, the rules around policy authority, they are different across all 50 states. It's not a unitary system like France. So there's just a lot of variety going on, and you can't, I've studied the local government for 30 years and I still can't pretend to tell you that I know all the differences across the 50 states.
The racial difference in timing of reopening was interesting. Is that because of, is that heavily weighted by some large cities in Texas and Florida, or?
Well, again, the models you're seeing here are state.
Mhm.
So no, they're not going to be heavily weighted by a large city because this is going to be a state number. And what else do you want to say about that, Xue? Just going to move to that slide. So, you know, this is ceteris paribus, right? So states with more minorities, independent of the other variable, after controlling for the other variables, are more likely to have an early reopen date. And when we take New York State out of the model, we still get this result because New York State was such a high case count. We took it out of the model early on so that we could just see if when you ran the model on 49, did you get something different? So this very well could be, you know, Texas, Florida, Georgia, the Carolinas affecting that. But this is after we've controlled for Republican. So, and those states all have unified Republican control. So even after controlling for that, we're still getting this positive effect of minority population, which would suggest, as we have seen in so many things, in this, particularly in the last month with the George Floyd and Black Lives Matter protests, that states disrespect their minority populations. Because what's not showing up in this model, which we had expected, is states with higher unemployment rates. We also did early models trying to measure people in essential businesses, and it's very hard to get a handle on what number you would use for that. We didn't see this economic public health trade-off that we expected. What we saw was a political and social safety net trade-off, which really put the whole article in a whole nother frame for thinking about it.
So there's some more questions or comments. How about some ideas about journals? We were just before the talk started, we were talking, and I did mention public health reports as probably the second public health journal that one can go to. Lancet, even though it's a British journal, is often very interested in things going in the United States, and they have a bunch of other journals as well. They like an extraordinarily brief article, but you can look at the requirements for those journals. JAMA also has a bunch of different journals. JAMA Internal Medicine might potentially be interested as well. Any other thoughts from anybody?
I was telling Martin before we started that we sent the water shutoff paper to 3 public health journals. And the good thing I love, you know, you get rejections in a day or 2 days or 3 days. And so after we weren't successful, we then have submitted it to utilities policy, which will move much slower in their review, but we've already gotten a very good review from someone who really understands the utility sector. So that'll be nice. But we would like to place some of this work in public health journals, but because we are social scientists who study government policy, we were wondering maybe we didn't have quite the right framing, We love the short articles. We love the fast turnaround. That's not the case in our field. Often it takes 2 years to get an article published. So the notion that things can move so quickly, particularly on something as timely as this, so we appreciate y'all's suggestions and input.
Are there more comments? This is a really, really interesting problem. And, you know, we think about health and social determinants of health and so on all the time. And we hardly ever think about water. So my gosh, it's really wonderful that you're taking this on, and hopefully you'll be able to get some of these papers in press pretty quickly. So I think a lot of people are going to be very interested in this.
Well, it would be really nice if the U.S. would sign on to the UN Convention. Well, we're not going to do that because we're nervous about the UN. But if we would protect people's right to water and consider that, you know, not from a you didn't pay your bill, therefore you don't get water because it's a commodity, but rather you don't have water, that's a problem for me because from a public health perspective, I need you to be able to wash your hands. And if we could shift our welfare conventions framework from this individual behavior, you're responsible, market-oriented, to a public perspective of we all benefit from public goods. That's why they're called public goods and public services. But we really struggle with that in the US because everything's commoditized and it's all a market. And in that kind of context, achieving public health goals and aims is just so much harder because there's not a public consciousness. It's like mask wearing, right? I'm not going to, wearing a mask protects you from me. It doesn't protect me from you so much. And so therefore I'm not going to do it because I don't have a sense of public well-being. I only have a sense of personal well-being. And that you see in lots of the historical differences in US policy compared to a lot of countries in Europe and even increasingly countries of the global South.
This is a free country, so I don't have to give you water, right? That's kind of the...
Well, it's a market commodity. If you don't pay, you don't get, sorry.
Yeah. And
that's sort of where it is. But in a lot of other countries, they'll have a minimum number of liters per day that you get regardless. And so there's been a lot of concern ever since Flint and Detroit, when it really became aware how many tens of thousands of households were getting cut off. That's when Oxfam started turning its attention toward the US and our problems here with water, which will get more severe as water rates continue to escalate.
Well, I think on that note, we can end it, and it would be wonderful to continue to interact and maybe even figure out ways in which some of us down here can collaborate with folks up there.
Well, that's the goal of all this. And so we're really happy to be able to participate and really glad that it's become an online format because it's much easier for us to get there now than it was when you had to travel and take a day off to try to get down and get back. So we are very interested. You can see the kinds of work that Xue and I do, and we would love to work with any of you all on public health related matters and bring our respective domain knowledges together to look at these issues. The other area that we do a lot of work on is age-friendly cities for children and for older adults, and we have data on built environment characteristics, zoning codes, comprehensive plans, level of service delivery, with the idea of creating a better community for all ages. So if anyone's interested in any of that and linking that to some public health measures, we're game on. We're ready.
So there are these, let me ask you just a different kind of question. There are these rankings that come out every year about the most livable cities in the world. And you get 3 in Australia and 3 in Canada and 2 or 3 elsewhere. Do you think that has any validity in the ways in which they look at those things?
I mean, just like the best colleges to go to, right? What are the metrics that they're using to determine this livability? What AARP did with the US is it took WHO's domains and then it put, what was it, Xue, between like 5 and 7 factors in each domain to come up with their index scores on their livability characteristics. And
they have categories, and in each category they have like 5 or 6 metrics inside each category to measure the livability of the place, and the data can down to zip code level, so it's very detailed measurement for livability.
Transportation, built environment at the neighborhood, housing, health, economic opportunity, public engagement. I'm forgetting one.
Transportation.
And you can go to their website and click on and put in your zip code and it'll tell you. I was on the committee that helped them develop that. They have a positive urban bias and a bias against rural and suburbs. And it sort of felt like we were privileging the rich for their wealth, because richer communities that meet these new urbanist design principles all looked really good. And yet the rates of older population are higher in places that are not considered good places to age in place. So are these people making irrational choices, or is it that they can't move? Or is it that we need to have a broader vision of what constitutes livability that isn't just this one perspective, which is a new urbanist perspective? And so all of those things are true. People don't have, only certain people have mobility. And people do have other ideas of what constitutes livability. And you can't, so yes, there are all these ranking systems. And the value of them, Martin, is that it encourages city leaders to think about where they might improve. It's almost like a best practice. Like, you want to be like this, so the next time you build something, why don't you make it a transit-oriented development or something like that? So it sort of suggests that a direction of movement, but they tend to privilege places that are already privileged, which isn't actually what we want to do. We want to figure out how to make places that aren't as good for aging in place. How can they improve? How can they get better doing things that make sense? So we have a project right now with some colleagues at Florida A&M University looking in low-income rural African-American communities, very limited resources. What are the things that people in those communities want that would make them more age-friendly? And it isn't going to look like new urbanism. It's going to look something very different. And so we want to be open to that kind of variety.
Well, this is wonderful stuff.
Well, thank you so much for giving us the opportunity.
It's been a really stimulating hour. So thank you so much. And stay safe and let us know about the publications as they go forward.
Okay, thank you.
Thank you.
Thank you very much.
Bye.
Bye.